Hi, everyone. Welcome to Facktor's next hot take segment. I'm Alex Knettel. I'm the client relations manager here at Facktor, with two of our team members that help clients with care transformation, Ryan and Natalia. Ryan, you want to go ahead and kick us off with another introduction?
Sure, Alex, thanks. My name is Ryan Rizik. I'm a licensed clinical social worker. I work as a manager for Facktor over the last 3 years. And my background work involves a lot of time with FQHCs and also working within hospitals and community health centers.
Wonderful. And Natalia?
And hello, everybody. My name is Natalia Sabuk. I'm a senior director here at Facktor, and I lead our clinical quality innovations division. My background is quality improvement, practice transformation. I'm also a patient-centered medical home certified content expert. Looking forward to our discussion today.
Wonderful. Thank you both for being here. Let's kick it off. So the public health emergency is, has been lifted in California, and a lot of grant funding has essentially dried up from COVID. What does that mean for organizations?
COVID provided a lot of funding for health centers. Health centers were really in need, and they were given a lot of opportunities to obtain funding. And now we're seeing that start to disappear and sort of run out. And so we're really seeing organizations being forced to pivot into this next phase of care. And, in California, we're lucky to have CalAIM and the initiatives of the state to help support health centers in this journey. And so we're really targeting some of those programs, and specifically ECM, as a really great opportunity. And ECM being enhanced care management, which really is, targeting those most complex patients.
ECM is definitely a wonderful initiative that many health centers are participating in already. Essentially, it is a program that focuses on care management for the highest risk patients, as Ryan mentioned. So there's different populations of focus, and these programs work through your managed care health plans. So, you'll be getting rosters of high-risk patients from your managed care plans, identifying those patients that really need that higher level of care. And truthfully, a lot of organizations are already doing this type of work, right? Care coordination, case management, care management. So now there's an opportunity through ECM for health centers to actually get reimbursed for doing that extra level of work and providing that extra level of care, which these patients really need.
Okay, so it seems pretty clear with the patient gains from ECM. Are there any benefits for the health center, or how can organizations financially support an ECM team?
As I mentioned earlier, a lot of health centers are actually doing this work already. It's just that a lot of these encounters, a lot of these visits, are not necessarily reimbursed. And now with the ECM program, there is an additional PMPM per member per month rate that you will actually obtain on a monthly basis for all of the patients that are enrolled in the program on top of your capitated rate. So this is really an extra incentive, an extra bonus really for offering that higher level of care.
In addition, we really see this as an opportunity for health centers to really start to build that support services staff capacity through the use of these funds, or build other service lines that they may be interested in. We've seen health plans that are reimbursing up to $450 per patient per month, and that really goes a long way when you think about a caseload being up to 40 patients. So if you can imagine that sort of funding and what it could actually do to not only support the ECM program, but also additional programming, it really does give such an opportunity for health centers to really put in the preparation for the next stage of healthcare.
Where's a good place for health centers to start when thinking about, either starting from scratch or growing an enhanced care management program?
Yeah, there's a lot of different places to start, right? So there's some organizations that are already doing this. There's some organizations that are thinking about doing this. This is definitely a program that you're going to want to be a part of, because it really is there as sort of the next phase of funding to be able to help support your journey towards that APM sort of realm, and really helping systems to build staffing that goes beyond just providers, right? We also want to be able to support case management and peer navigators and CHWs. And that really is what the ECM program is allowing for.
And, hiring new staff if you don't have the staff already, and just developing the infrastructure for these kinds of programs is it's important to make sure that all the key stakeholders are around the table and that there is buy-in for something like this, and that everyone really understands why we're doing this, right?
But thank you both for your time. I really appreciate it. And we'll see everyone next time. Thank you.
Thanks, Alex.
Thank you.